Thank you for joining us on this daily briefing. I'm Supervisor Hilda L. Solis, Chair Pro Tem of the Los Angeles County Board of Supervisors. Dr. Barbara Ferrer, Dr. Christina Galley, and Kevin McGowan are here today to provide their updates on the county's health response to COVID-19 pandemic. And we're also being joined by Heidi Marston, the Interim Executive Director of LAHSA, the Los Angeles Homeless Services Authority, and she will share details of our ongoing collaborative efforts to protect people experiencing homelessness. We recognize the profound toll the crisis has taken on our LA County residents. To that end, all of our county departments, partner agencies, and service providers are working around the clock to help those struggling and those most in need. I want to thank our essential employees for their noble service. Today, in fact, in partnership with the Los Angeles Community College District and East Los Angeles Community College, we opened a testing site at ELAC. The Los Angeles County is offering a drive-through COVID-19 testing site for the community, 7 days a week from 9 a.m. to 5 p.m. They can test up to 250 persons per day. The testing site is operated by our hardworking Roybal Health Center staff, LA County Fire Department and lifeguards, and volunteers from across the 1st District. The drive-up sites provide individuals in East Los Angeles, Monterey Park, and the surrounding communities with a quick and safe way to get tested in order to slow the spread of the virus. Like with all county testing sites, please visit coronavirus.lacity.org/testing or call 211 to see if you're eligible for COVID-19 testing. Next, I'd like to take a moment to thank Governor Gavin Newsom for his leadership during these trying times. On Friday, Governor Newsom announced the Project Room Key initiative to provide shelter to many Californians experiencing homelessness by leasing hotel and motel rooms. At this time, Los Angeles County has a goal to secure 15,000 rooms for vulnerable individuals experiencing homelessness in partnership with the state, our cities, LAHSA, and the hotel-motel industry. Homelessness and health experts have shared that the unsheltered homeless population is at a greater risk of contracting the virus because many are older and have serious underlying health conditions. People experiencing homelessness have a higher burden of cardiopulmonary and immunocompromising conditions like COPD, chronic obstructive pulmonary disease, heart failure, diabetes, and they also experience accelerating aging and frailty. Additionally, people experiencing homelessness have limited access to hygiene supplies, living conditions that limit infection control practices, and often live in communal settings such as shelters, on the street, or crowded encampments. These hotels and motels will help us flatten the curve by providing a safe space for individuals to isolate, especially for people who are over the age of 55 and who have underlying medical conditions. Project Room Key is a massive undertaking that requires many people and agencies working together to lease these motels and hotels. This is a high priority for the county, and we thank our service providers for stepping up to the task and county disaster service workers for helping to staff these sites. Expanding shelter countywide is the goal of the county and has already been working toward before the COVID-19 crisis, but it's now more urgent than ever. As COVID-19 continues to spread throughout the country, we have a moral and ethical responsibility to do our part. Project Room Key will ensure individuals receive wraparound services such as meals, custodial services, mental health, and healthcare services during the public health crisis. If you have a hotel or motel that could be leased for Project Room Key, please reach out and contact the County of Los Angeles. In conclusion, the county will continue to work with our cities, the state, community, and private partners to assess facilities and properties throughout the county that could serve as quarantine, isolation, and testing sites. This is no small feat, but we must work together, practice compassion, and utilize every resource that we have available to stop the spread of this virus. And now, I have the great honor and pleasure to introduce Dr. Barbara Ferrer, our Director of Public Health.
Good afternoon, everyone, and thank you so much, Supervisor Solis, for your leadership across the county and for really reminding us every day about what's our role as people in government. You know, it's here to be of service, and every day you live your life as an example to all of us for what that means. I want to update you today on our current status here in LA County. Sad to report an additional 29 deaths have occurred. 17 of the people who died were over the age of 65, and 16 of the people who are over the age of 65 had underlying health conditions. 7 people passed away who were between the ages of 41 and 65, and 5 people between the ages of 41 and 65 had underlying health conditions. One person was younger, between the age of 18 and 40, and they also had underlying health conditions. We don't currently have information for the 4 additional deaths, 3 of which occurred for residents in Long Beach and 1 which occurred among a resident from Pasadena. This brings the total number of deaths in LA County to 198, and unfortunately, our mortality rate has risen again to 2.6%. My thoughts and prayers are with everyone who's lost a loved one to COVID-19, and I wish you peace as you heal. Today, we're also reporting 620 new cases. Over the last 48 hours, our total is 1,170 cases, and that brings us to 7,530 total cases here in LA County. These cases include 256 cases reported by our partners in the city of Long Beach and 80 cases reported by the city of Pasadena. We're also reporting 12 confirmed cases amongst people experiencing homelessness. This is an additional 2 people from the 10 people I reported yesterday. 77% of all of our positive cases continue to occur among people between the ages of 18 and 65. And again, as a reminder, this infection is spread by people of all ages, cases. Currently, there's 1,033 people who are hospitalized, and 44% of the people who are hospitalized today are over the age of 65. 17%, however, are under the age of 45, a stark reminder that everyone can not only become positive for COVID-19, but actually can become ill enough to require a hospitalization. You can see our complete updated report on LA County cases on the Department of Health's website at publichealth.lacounty.gov. We're also currently investigating 131 institutional settings. This number continues to grow with the number of positive cases that I announce every day and the increased number of deaths. These institutions where we're investigating have at least 1 confirmed case of COVID-19, and as a reminder, they include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in our institutional settings is 596, and this includes 314 cases amongst residents and 282 amongst staff. And I'm really sad to report that in our institutional settings, the number of deaths has also risen to 37 residents who were positive for COVID-19 who have died. Today, we're reporting 43 confirmed cases in the jail facilities. This is 3 inmates and 40 staff. There are 10 cases in the state prison system in LA County. That's 8 inmates and 2 staff. And there are 2 cases among our juvenile facilities, and those are both among staff. In the shelters that are serving people experiencing homelessness, we have 4 confirmed cases. 2 were among staff residents, and 2 were among staff members, and 2 were among residents at the shelters. As a reminder, we post a list of facilities with confirmed cases on our website once those facilities have had an opportunity to notify their staff, residents, and families. Our DPH teams do work with every single one of the institutional settings that has at least one confirmed case, and the management and the staff are working closely with us to try to protect the health and well-being both of employees and of residents. Many residents in these facilities are appropriately quarantined, and we ask all of you to understand that this means that there are absolutely no visitors allowed at all of these facilities. I wanted to talk a little bit about healthcare workers today. They're the front line of the pandemic, and we all owe them an enormous debt of gratitude. So thank you to everybody who's doing healthcare work in all of the institutions that provide medical services and clinical services to the residents here throughout the county. We have documented 324 healthcare workers that have tested positive for COVID-19. The three main settings that are reporting these cases include our hospitals, which report 58% of the cases, outpatient facilities, which report 16% of the cases, and emergency medical services, which is reporting 6% of the cases. Nurses are the group of healthcare workers most likely at this point to have tested positive for COVID-19, followed by physicians, EMS, paramedics, and EMTs. We're sad to report that 2 healthcare workers who were positive for COVID-19 passed away. I spoke about this earlier last week. And again, to the families and friends of these brave frontline workers, we're so deeply sorry for your loss. And for me, the words thank you don't really convey the gratitude I feel to all of the frontline healthcare workers. You're heroes, and we appreciate your commitment to continuing to take excellent care of all of us, while we know you're facing the impossible task of juggling caring for your families while showing up every single day on the front lines. As of yesterday, 36,500 people have been tested in LA County. 15% were positive. I want to clarify that when we report on the number of people who have been tested, there is a lag time. We are reporting on not only the number of people who have been tested, but we're actually reporting on the number of people for whom we have test results. So the last few days, particularly across the county and the city of LA, there's been a dramatic increase in testing sites and the availability of testing, and our numbers will not reflect this for a few days because we won't have those test results back yet. And testing capacity continues to improve every week here. Please note that all of the county testing sites and the city testing sites are limited to people who are symptomatic. But we're still not up to having the capacity to test 10,000 people a day. So I want everyone to be aware as we get to that capacity, the number of positive cases will continue to rise here in the county. And certain groups of people who are symptomatic, we ask that you please make sure you talk with your provider and get tested if you have COVID-19 symptoms. These, again, are people who have greater risk for serious illness and disease. That includes people who are 65 and older, people with serious underlying health conditions, and pregnant women. If you need help finding a test site, please go to the county's website. They're listed there, and it's very easy for you to sign up and be seen at one of the county and the city test facilities. Today, I also wanted to talk a little bit about our guidance for people with differing abilities or people with disabilities during the COVID-19 pandemic. I've talked a lot about the fact that people with chronic conditions, and this includes heart, lung, kidney disease, diabetes, as well as those with a decreased immune function, are at higher risk of becoming seriously ill if they were to become infected. But people of differing abilities also may have increased risk if they too fall into one of the categories of having an underlying health condition, especially those that affect lung function. And so for all of us, including people with differing abilities, the best way to keep from getting infected is to reduce the contact with people who may carry the virus and with places where infected people may be present. But I want to note that for people who require caregivers every day to be in their lives to support their ability to fully function, we have special instructions for you. And again, we ask that the first point is to limit your close contacts with everyone else as much as possible. This includes your family members. We recognize that you have a caregiver that often is in close contact with you, but it's very important for people with differing abilities that rely on a caregiver to make sure that they're trying to keep 6 feet away from everyone else, even other people in their household. Caregivers need to be particularly careful not to bring the virus into the house of a person with differing abilities. If they have any symptoms of illness, they should stay home, and an alternate caregiver should be sent to your home. Even if they don't show any signs of illness, caregivers should always wear disposable gloves and a face mask at any time when their job requires close contact with you. Need to have all surfaces wiped down frequently, particularly those surfaces that you're both touching. And it's a good idea to also make sure that you're wiping down any equipment regularly. Everyone in the household needs to wash their hands frequently, and everyone needs to avoid touching their faces. Folks who have differing abilities and have physical limitations in getting around should take this time to make sure that they've arranged to have their food, medication, and supplies delivered. Be sure you have everything you need to meet your ongoing health needs for at least the next 30 days. This includes having a personal emergency plan that writes down the information on how to reach all of your healthcare providers, any specialists and therapists, and any 24/7 links that are provided by your healthcare team. There should be contact information on the pharmacy you use and information on other services that you use, such as meal programs, care coordinators, and any telehealth services. If you're relying on home medical services, please make sure that that information is also included on the care plan and that there's a transportation plan in place that allows you to get safely to and from any appointments for out-of-home medical services. If you develop any symptoms, mild symptoms, you should be in touch with your regular healthcare provider as soon as possible. We do have detailed guidance on our website for people with differing abilities. That's publichealth.lacounty.gov. This guidance includes information about resources for food and transportation, as well as specific guidance on cleaning and disinfecting. I want to thank so many of you for settling into routines that allow you to stay home safely, maintain your physical distance from others, and now you've adopted wearing a cloth face covering when you must be out. I know this is temporary. I know it's going to change, and we will get back to many of our normal routines, but it will take significant time. And please understand that we have weeks to go before we're able to lift any of our health officer orders. And I know this is hard and that many people have made enormous sacrifices for us to be able to get through these days together. And I know also that many people are observing our faith holidays and traditions right now, and we must all do this while we stay home. This is not easy. Please know that what we're doing right now is saving lives, the lives of those people who are most vulnerable, the lives of those people you love, and your life. We're going to get through this together, LA County, and I'm grateful for all that you're doing. And now it's my pleasure to introduce Dr. Galley, the Director of the Department of Health Services.
Hi, I'm Dr. Christina Galley, the Director of the county's Department of Health Services. Thanks for joining us again today. My thanks to the Board of Supervisors, all of the county elected officials, all of our partners in homelessness services and on the healthcare front lines for all the work that you're doing every day and for bringing the resources to bear to be able to combat this pandemic. We are at a critical moment in the trajectory of COVID-19. The only way, the best way to slow the trajectory of this disease is by observing the safer at home and social distancing, physical distancing guidelines that have been put forward by the Department of Public Health. I know that they're hard. I know that people are under some stress and anxiety, and I know that this is a difficult time for many of you. But I want to thank you for your observance of these rules, for these health officer orders, and just encourage you to stay with it in the weeks to come. It is making a huge difference in our ability to be able to lessen the scope and the peak of those infections, and it's making a difference in terms of saving the lives of those you love and those around you. We'll be making some comments later this week, likely on Friday, to give a broader picture of what we anticipate in the days to come in terms of modeling the trajectory of this epidemic. So we look forward to having you join us on Friday for those enhanced comments. Today, I'll focus on DHS's role in serving people experiencing homelessness and also in those coming out of our correctional institutions, and I'll provide a brief recap of the bed count numbers. The Department of Health Services Housing for Health Unit works with a variety of partners, including LAHSA, who's with us here today, the Department of Mental Health, Department of Public Health, and others, on providing a range of supports to persons experiencing homelessness. The DHS staff provide expertise in establishing the quarantine and isolation sites that have been established throughout the county. They're training outreach teams and interim housing providers on PPE and medical protocols, and they're providing services to some of the more medically fragile and vulnerable persons experiencing homelessness at some of the specific sites. DHS has a specific role at one of the sites, which is Dockweiler, which today is in the process of moving from the site at Dockweiler State Park over into an alternative site at Bell Gardens to serve those individuals who are most medically fragile in terms of having complex underlying health conditions, or who might have substance use disorders or complex behavioral health conditions or mental illness. They provide those services on that site to a large set of individuals who have been identified as needing them, and we will continue to do that in the days to weeks to come. To date, there have been 77 clients served at that Dockweiler site, with more anticipated to be served in the weeks that will come. We also have services that are available on the MLK campus in South LA that are being provided through partnership with JWCH. And I want to extend my thanks to all of the partners across the county who have pitched in at the various quarantine and isolation sites to provide housing services, homelessness services, wraparound services, case management, medical and clinical services. It takes a team to pull all of this together, and I'm grateful for the contributions of so many people. In the correctional health environment as well, as you may know, there's been great efforts to be able to reduce the size of the jail population, which is currently down to about 15,500 over the course of the past several weeks. This is largely done by reducing the bookings of inmates into jail where possible, with an eye on preserving public safety, and then also on securing release of certain individuals who do not require a correctional environment. Department of Health Services has been working in partnership with the Superior Court System, with the Sheriff's Department, the Probation Department, and our justice partners broadly to be able to plan for housing and supportive services options for individuals who are medically fragile or who have serious mental illness and need placement in a housing environment upon release. I am pleased to report that in the past month, we've already connected 200 individuals with serious mental illness or who are extremely medically fragile with housing programs, and with plans to be able to house an additional 200 in the next 2 weeks. And again, I just want to extend my thanks to the Sheriff's Department and to the courts and all of our justice partners for helping to ensure a coordinated process for identifying those individuals who are most at risk and allowing us to connect them with services wherever possible. As a brief summary of the bed snapshot for today across the county, we have 1,548 open medical surgical general acute care beds. This includes 247 ICU beds. About a third of those beds are located within DHS's system of county-operated hospitals. You can always find all of the most up-to-date bed numbers on our website at dhs.lacounty.gov. As I've mentioned before, All of the hospitals are working on implementing their surge plans in line with the governor's order and expectation of having hospitals be the primary site of surge as needed for patients with COVID-19. This is then supplemented by alternative care sites such as the LA Surge Hospital and the Mercy Ship, as well as other sites. Finally, just want to close with a note of gratitude again for all that people are doing to support the Safer at Home efforts and to support social distancing guidelines. You've made a huge difference in curbing this epidemic, and we're very thankful for your efforts. With that, I'll turn it over to Kevin McGowan, the Director of the Office of Emergency Management.
Thank you, Dr. Galley. Kevin McGowan, the Director with the Office of Emergency Management. Good afternoon. I want to take a moment to recognize and state how proud I am of our county family and our response to this emergency, and especially the dedicated professionals that come from many different agencies and disciplines, not just from the county, but from our partners at the state and federal level that are supporting operations at our Emergency Operations Center, which has been activated for over a month period of time. The Emergency Operations Centers for the county provide some critical functions in our ability to combat the emergency that we're undertaking right now. And one of those critical factors I'd like to take today a few moments to discuss, and it's the medical shelter program. So since its inception, we've been focusing on building capacity to help our different partner agencies in preparing for the surge, and in addition to that, providing adequate level of support for people who may not need hospitalization, but might not be able to provide that support for themselves. And so the development of the medical shelter program took place and is being coordinated and led through the Emergency Operations Center with a multidisciplinary group of individuals. Currently, the county is operating 6 medical shelter sites, and approximately 900 units are encompass those 6 sites. Currently, we have about 130 people that are residing at those sites so that they can use the quarantine and isolation period of time with those wraparound supportive services, and that once they accomplish the goal of that time period, we then discharge them back to a better place than when they originally came. I can't underestimate or underemphasize how important the partnership has been with our community. I've spoken a few times at these press conferences and asked for the support of a whole community approach to this mission. It really takes all of us to come together. This is a big burden and lift by all of us, and I'm really appreciative of the support that we've had from all of our communities where these hotels, motels, and RVs are functioning. And it's a very critical and important role. And I know that all the guests and clients that are using these facilities are very appreciative of the support. And with that, it's my honor to introduce Heidi Marston, the Director for the Los Angeles Homeless Services Authority.
Good afternoon. I'm Heidi Marston, the Interim Executive Director for the Los Angeles Homeless Services Authority. LAHSA and its partners are working around the clock to urgently bring as many people experiencing homelessness as possible indoors. We're doing this through a few areas of focus, including unprecedented rapid expansion of our interim housing portfolio. We're providing intensive and focused outreach to our most vulnerable on the streets, and we're also securing resources, staffing, and supplies that are needed to support all of those functions and the expansion of our homeless system. As you've heard, we're focusing really on 3 tiers of interim housing. The first tier, Dr. Galley and Kevin spoke about, which are the medical shelters. The second tier are our countywide congregate interim housing shelters. This includes the 7,300 interim housing beds at center sites across Los Angeles City that has 565 beds across 13 shelters. So we're rapidly expanding that portfolio. The third category is, as you heard earlier, is what we refer to as Project Room Key. Project Room Key is a partnership between LA County, LAHSA, and the state of California to secure hotels and motels for the purpose of bringing people who are experiencing homelessness inside. These are for individuals who are deemed highly vulnerable per CDC guidance, meaning over the age of 65, or individuals who have underlying health conditions, and individuals who are asymptomatic, so not yet sick or exhibiting symptoms. The goal is to bring 15,000 rooms online countywide, and LAHSA, the City of LA, and the County of LA will be leveraging money we've received from the state for Project Room Key, and will also be looking to FEMA for federal reimbursement for these efforts. As I said, we're really prioritizing individuals for these sites who are unsheltered, currently living on the streets, or who are in shelters and deemed highly vulnerable, where they'll be better suited in a setting where they're on their own because of their vulnerability. This is also an effort to help us decompress our shelter sites to ensure we're maintaining at least a 6-foot distancing between the beds within our shelters. As of this morning, I'm excited to announce that in partnership with LA County Fire, we've opened 5 sites since last Friday that now provide over 405 rooms for these people experiencing homelessness who are at the highest risk during this pandemic. By early next week, we'll have more than 800 beds online across more than 12 sites countywide. Again, I just want to emphasize the amount of work that's been done to not only get these beds up and running, but thank our service provider community who has stepped in to make sure that these beds are operational and that folks in these beds have the supportive services they need during this time. Each site is operated by a homeless service nonprofit provider with professional expertise in administering services for people who are experiencing homelessness. Each site is also supported with nurses who conduct medical screenings twice a day for both the people who are staying at the hotel as well as the staff to ensure that we're monitoring symptoms, and if folks become symptomatic, we're able to move them to a place where they can self-isolate. Additionally, we're contracting with private security firms to provide 24-hour security at each of these locations, and each hotel resident receives 3 meals a day in their room. All the occupants are expected to abide by the Safer at Home order, just like all of us, and social distancing guidance is in full effect. So we're very excited about this opportunity to bring folks inside and to make sure that we're preventing the spread of coronavirus among this very vulnerable population. I also want to take a minute to talk about what we're doing to address emerging information nationally on the disproportionate impact of COVID-19 on African Americans. In recent years, LAHSA has become a national leader on advancing racial equity in homeless service systems, and we've been changing how our system works to reverse the decades of institutional racism that has led to disproportionate levels of homelessness among African Americans. We're tapping into that expertise and engaging with national experts to measure and minimize disproportionate impact of COVID-19 on Black people and people of color. And we'll also use that data to keep improving our system to advance equity throughout it. And with that, Grace, we are now ready for questions.
Thank you. Ladies and gentlemen, if you wish to ask a question, please press 1 and then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question, you may press 1 and then 0 at this time. And our first question is from Jim Rope with Westwood One News. Please go ahead.
Thank you very much. Good afternoon. And on World Health Day, thank you very much, doctor and doctors, for your service and your help with all of this. I'm curious about the long-term care facilities. There seems to be an enormous outbreak in these places. Aren't they under the same sanitary guidelines as hospitals? And if not, why not? And when the outbreaks began in these facilities, was there guidance sent to them to clean, disinfect, do whatever, contact trace, and all of that? They seem to be petri dishes for this thing. So what is the underlying cause? Is there an underlying cause? Does this speak to these facilities in general? Why do these long-term facilities seem to have such a problem?
It's a great question. So I think I want to start with noting that while the list is very, very long of the number of institutions where we're doing investigations, in the majority of the institutions, we don't yet have outbreaks, which really means we have less than 3 known cases or presumed cases of COVID-19 among residents in the institutions, which really brings me to the second part of the question, which is what do we do? And how are we supporting institutions to have the best infection control practices? As soon as we know that there is a case in any institutional setting, we have a team that actually makes contact, oftentimes goes out and reviews what the practices are and the protocols that are in place in these institutional settings to prevent spread. So I want to say that there are very strict regulations in all licensed healthcare facilities, including long-term care and skilled nursing facilities, for in fact being able to absolutely do good infection control. And they're all required to have protocols in place that allow them to both isolate people who are positive for COVID-19, presumed to be positive for COVID-19, or close contacts of anybody who may have either a positive diagnosis for COVID-19 or potentially is positive for COVID-19. But the reason it's so easily transmitted, COVID-19 so easily transmitted in these institutional settings, is because people are often both physically close together for activities, for meals, and their caregivers in these institutions who are doing incredible jobs taking care of some very ill people who need a lot of support, often care for more than one person during the day. So if in fact an employee in a facility is positive for COVID-19 and is asymptomatic, not showing any symptoms, and is caring for 10 to 15 patients in a facility, you can see that the risk for there being exposures is much higher. And at this point, we have increased our capacity to supply these facilities with surgical masks, and we've asked that, in fact, all care be done with surgical masks. But routine care in these facilities does not require the same level of personal protection equipment that is, for example, required at hospitals. And we have lots and lots of different employees working with many patients. So we also have patients who infect each other because they often share rooms and they share time together. So in all of these facilities, everyone's doing everything they can to reduce the spread, but the facilities are organized in a way that actually makes that spread somewhat easier. And I'll take the next question.
Thank you. Next, we'll go to the line of Brian Melly with AP. Please go ahead.
Hi, Dr. Ferrer. I'm trying to better understand this number of negative lab results that you previously referred to. I think you said it was around 20,000 yesterday. Can you tell me what does that number reflect? Is it from the universe of the 36,000 tests conducted that you reported today? My assumption would be that if you tested 100 cases and 10 were positive, then 90 would be negative. Is that not what that figure reflects? And is that not being reported? And what impact does the lack of that data have on your modeling?
Yeah, I mean, obviously we're troubled by the lack of electronic reporting of lab results for some of the newer labs. I want to note that everyone's working really hard to get those systems up and running. But if you think that, you're absolutely right to note that the calculations are off. We hope that this problem will be resolved by next week and that we'll be getting both accurate reporting on negative cases moving forward and also address sort of the lack of reporting.
That uncertainty has to do with the vigilance with which people maintain social and physical distancing. With that, we'll conclude this portion of the conference and move to Spanish remarks. Thanks, everybody.
Buenas tardes. Gracias por escucharnos hoy día. Soy la supervisora Hilda Solís de la Junta de Supervisores del Condado de Los Ángeles. La doctora Barbara Ferrer y nuestros expertos están aquí para dar información sobre la salud de nuestras comunidades y noticias de coronavirus. También están con nosotros representantes de LASA, la Autoridad de Servicios para Personas Sin Hogar de Los Ángeles, y van a decir lo que estamos haciendo para proteger a las personas sin hogar. Todos nuestros departamentos del condado y grupos comunitarios estaban trabajando todos los días para ayudar a todos quienes necesitan ayuda. Quiero dar las gracias a nuestros empleados esenciales por sus servicios. Empezando hoy, el Colegio Comunitario del Este de Los Ángeles está ofreciendo pruebas de coronavirus gratis. Si estás tosiendo, tienes fiebre o no puedes respirar, por favor llama a 211 para hacer la prueba de coronavirus. No debes de tener miedo. Nadie te va a preguntar por tu estatus migratorio. Tienes que llamar a 211 para hacer una cita primero y tener ciertos síntomas. Me gustaría tomar un momento para dar gracias también al gobernador Gavin Newsom. El viernes el gobernador Newsom anunció un proyecto llamado Project Room Key para ofrecer a las personas sin hogar un cuarto en hoteles o moteles a través del estado. Las personas sin hogar corren más riesgo con coronavirus porque muchos son de la tercera edad y tienen problemas de salud. Project Room Key va a ofrecer hogar, comida, servicios de salud mental y atención médica durante esta crisis de salud pública. El condado está trabajando con el estado para proteger a las personas sin hogar y a todas nuestras comunidades para reducir los casos de coronavirus. Muchas gracias. Con eso me da un honor a introducir a la doctora Barbara Ferrer, directora de Salud Pública.
Buenas tardes a todos y muchas gracias, Supervisora Solís. Es un honor trabajar con usted y ser parte de este equipo colaborativo. Para actualizarlo sobre nuestro estado actual, estamos tristes de informarles que hay 29 personas adicionales que han muerto desde ayer. Esto eleva el número total de muertes a 198 en el condado de Los Ángeles. Y nuestra tasa de mortalidad de COVID-19 es 2.6%. Para aquellos de ustedes que han perdido a un familiar o amigo por COVID-19, lo sentimos profundamente. Pensamos en ti todos los días mientras hacemos este trabajo. Está en nuestros pensamientos y oraciones. Hoy también estamos reportando 620 nuevos casos. En las últimas 48 horas ha habido 1,170 casos nuevos. Hay un total de 7,530 casos en el condado de Los Ángeles. 1,714 personas han sido en algún momento hospitalizados, el 23% de todos los casos positivos.